Hi, I'm Sinitta, and some of you may know that I recently had the AstraZeneca vaccine, and I'm fully recovered from that. A lot of my friends and family still have concerns about having the vaccine, and so I've gotten together with Dr. Helen to discuss and talk through some of these concerns. So, Dr. Helen, you've experienced firsthand a lot of people's concerns from the Black community, and you've had the vaccine yourself. How can you reassure people that it's safe and that it's a good idea to have the vaccine?
First of all, I think it's very normal to have concerns, and this is the quickest vaccination we've seen being turned around in medical history. But I would really like to reassure everybody that the COVID-19 vaccination has been through the same strict regulations, criteria, trials as any other vaccine. And the reason it's been turned around so quickly is because normally you would wait and do phase one, then phase two, then phase three. And actually, what they've done is they've run some of those different phases in parallel. So that's speeded up the process. So I want to reassure everyone that the vaccination has been approved by the MHRA, the same as any other vaccination. It is safe, it is effective, and the quality is high, as high as you would want of any vaccine.
Yeah, I think what people really need to know as well is what to expect. What are the side effects, and so they know what's normal.
So some people won't have any side effects at all after they've had the vaccine, so they'll feel completely well. It's common to get some side effects, but they tend to be mild, and you can expect to feel some soreness in your arm, perhaps, maybe a headache, maybe a fever, maybe some achiness. That's normal, and that's to be expected. And actually, that's a good sign because that means that our immune system is being triggered, but that doesn't mean it's not safe.
I felt passionately about not spreading the virus and also being protected, but also wanting to get back to a sort of new normal. But I understand the concerns. My mother has historic concerns, from different experiences she's had. And I just thought rather than be bullying her into you've got to have the vaccine, that actually it's really important to hear people's concerns and other people in the Black community who feel the same way.
First of all, I think that it's important that when you're making a decision about whether to say yes to taking the vaccine or not, you need to be happy that you've got all the facts about that so you can make an informed decision. There's so much misinformation out there, and there's so many myths floating about that it's really important that we set the record straight. There's that wariness, there's a lack of trust in institutions, in the government, based on personal experiences. And it's really difficult because that's emotional, isn't it? And I totally understand why people would be concerned. There's two ways of looking at having the vaccine. And you've mentioned there's the fact that you can have it because you don't want to end up seriously ill and in hospital and at risk of dying. But you can also have it because you don't want to pass it on and you don't want to infect other people. You know that it's very, very effective at reducing serious illness and reducing those admissions. Not only that, but we know that it's very effective at reducing the chance of you actually getting the infection, and therefore it reduces the chance of you passing it on. And that was one of the things for me, definitely, with elderly parents. I didn't want to be responsible for passing it on to them and them getting unwell.
One of my concerns is, first of all, I have trust issues with the NHS doctors.
I mean, if there is a whole generation of Black people who won't have the vaccine, what will happen?
What saddens me about that is that we know that Black people are disproportionately affected, and that's only going to get worse if we don't, and not enough of us have the vaccine. What I'm seeing data that's showing that this is very effective. It's showing that it's safe. It's showing that it's gone through rigorous testing. It's showing that it's of high quality, and it's showing that it is doing what it's meant to do, which is reducing the amount of people becoming seriously unwell. For me and my colleagues, the way in which we've been trained, we've taken the Hippocratic Oath, we've gone through training to give safe treatment to patients. There's loads of safety procedures in place.
There are a lot of Black people from the Black community that do advocate taking the vaccine. and been involved in developing the vaccine. And I don't think a lot of people are aware of that. Can you explain who those people are or what their involvement's been in the developments?
Yeah, I think it's really important to remember that, and also for us to feel proud of the Black community, because, like you say, well, first of all, a lot of the NHS frontline workers are part of the Black community, so that's the first thing. The other thing to remember is that if we look at the trials that have been done on the vaccines, actually Black people have been represented in the trials around 10%, and that's a lot higher than previous vaccines that we've seen.
I work with a lot of young people, and there are a lot of concerns that the vaccination is starting to reach their age group, and there's concerns about fertility.
There's no data or evidence to suggest that COVID-19 or the vaccination have a negative impact on fertility whatsoever.
So having had the vaccine, and I'm feeling quite well and everything a few weeks later, I have seen the latest developments that now under 30-year-olds, I think, are being offered an alternative to AstraZeneca. What does that mean for those of us who've had the vaccine already as well?
Yeah, there's been a lot of stories about blood clots and AstraZeneca in the press over the past few weeks, and it is confusing and it does incite that anxiety. The MHRA, who are the same people who approve the vaccines as safe, have now issued a statement. And in that statement, they say that the AstraZeneca vaccine should still be given. It's still safe. But we know that in a very small amount of individuals, there's an extremely rare and very unlikely chance of blood clots.
There's so many young people who don't really think the vaccine is necessary, but will it actually protect other people by having the vaccine?
Yeah, we now know, we're now seeing evidence come out that if you've had the vaccine, it means you're less likely to pass on the virus to others. So if you're not going to do it for yourself and you feel like you're fit and healthy and your risks are low, think about doing it for your parents or your grandparents or some elderly family members. Think about accepting the vaccine, knowing that you're going to be potentially protecting them.
My mother, so we know how she's feeling, but should she change her mind, would she be able to still have the vaccine later down the line? And also, what do people do, like if they're not registered with a GP?
So at any point, if anyone changes their mind, they can still access the vaccine, even if they've moved on to different groups of individuals and they've moved away from the priority groups. She'll still be able to access the vaccination if she changes her mind. And then in terms of what do people do if they're not registered with a GP, and actually there'll be lots of people, thousands of people in the country who aren't. Everybody has access to the vaccine, no matter where they live, no matter what their immigration status, whether they're registered with a GP. And actually, most people live within about a 10-mile radius of a vaccination centre. There's a real opportunity to go, yeah, I'm going to do my bit. Even if I'm not worried about me, I'm going to do my bit for the community and for other people in my family, in my friendship group, and in my community and in my church.
Well, I hope that was helpful, useful, good information. I hope you feel heard and that some of your questions have been answered here today. Dr. Helen, thank you so much for joining us. I hope we're able to move forward, to rebuild trust, and move forward in hope, and that we can just kick this virus and get to a new normal.